Alright, the first thing that's on your sheet should be, well, that I've collected from you, you can't see, is aorta. And I'm going to zoom in here. And the aorta is this blood vessel right above the heart. And you see that it loops up and then back down this way. This is all aorta. From the time that it leaves the heart, it's the largest artery in the body. And it changes names. As it goes up, it's called the ascending aorta. As it goes over, it's called the aortic arch. Briefly back here, it's the descending aorta. Then back in this space, as it goes through the rib cage area, it's called the thoracic, because your rib cage is called your thorax. Just like a bug has 3 sections of its body: head, abdomen, and thorax. So do we. Head, thorax is your rib cage, and abdomen is what's below that. So since this is called the thoracic aorta right here, down here would be called the what? Abdominal aorta. And you'll find one thing to be pretty consistent about blood vessels, and that's that they keep their name until they split off in some way. When there's a branch that comes off, that splits it off, that's where they change names. So up here at the top is one of the few places in the body, the top of the aorta is one of the few places in the body where you're asymmetrical. Look at this, and I wish it wasn't completely covered up by that sternum there, but the aortic arch that comes up, how many branches are coming off the top of it? 3. Which doesn't make a whole lot of sense, but there are. With 3, you already know it's going to be asymmetrical. But coming up from the aorta is this short little section called the brachiocephalic trunk. Brachio means arm, just like in your biceps and triceps are called biceps brachii. That means arm. So, and cephalo means head, which means this is the branch that's going up to the head and to the arm. This very brief section then splits off into the right common carotid and the right, what's this? That's right, subclavian. Okay, subclavian means, what does sub mean, guys?
Down.
Yeah, underneath. Okay, sub, underneath or below. Clavian would be clavicle, subclavian. So this branches off into right common carotid and right subclavian. The other side, we don't have a brachiocephalic trunk. Rather, these blood vessels come directly off of the aorta, and they don't have anything in between them. So this is the left common carotid. This is the... Let's say it together. Left subclavian. Good. Alright. So, those are the first few on the sheet. So we got the common carotid, subclavian. Then, as we travel down this way, we're going to the arm. Okay? Through the armpit, I skipped this step. Through the armpit, it's called the axillary artery. Things that are related to the armpit are referred to as axillary. Underneath here, as this branches off, you'll see that this going through your arm is your brachial artery. Now, I want to mention this. This right here is your arm, just from your shoulder to your elbow. Okay? From your elbow down to your wrist is your forearm. Okay? So this is your arm. So this is brachial is the major artery going through your arm. When we take blood pressure, when we learn how to do that, we're going to be listening for turbulence in this particular vessel. Huge artery going through there. Okay. Brachial will then branch into these 2 arteries going through the forearm. Yes. Why are they named ulnar and radial?
That's what the bones that they're next to are called.
Yeah, because these are named after the bones that they are adjacent to. Okay? So your radial artery is located right next to your radius, and your ulnar is located right next to your ulna. Easy way to remember which one's on which side, and this will help you with the bones too. Okay? Because you're like, well, one's bigger. Well, sort of. They're both bigger than the other one at each end. The radius is bigger than the ulna at the wrist, and the ulna is bigger than the radius at the elbow. The easy way to remember it is this. Your thumb is big. Agreed?
Yes.
Your pinky? Not so big. Good so far. Okay. Your thumb, larger around, and the circle, if you're bigger around, you have a larger radius. Okay? Therefore, your radius is on which side?
Thumb side.
It's on the thumb side. And your ulna is opposite. Somebody tried to give me a little trick for the ulna. Said, you know, ulna, pinky, up. So, that's another way to remember it too. So, radial artery. Is that great? Alright. Well, we tried. Radial is on the thumb side, ulnar is on the other side. This is the one that when you're feeling a pulse, put your fingers there to feel a pulse, you're feeling your radial artery on your thumb side. Okay? Then they branch off and so on and so forth. Get your palmar arch and so on and so forth. And then arteries, we have common iliac. Now, just like common carotid, it's called common until it branches into an internal and an external. Aorta, its name stops right here. Okay? The blood vessels continue, but they branch off right here. Right here, this major vessel is the right common iliac artery. Huge, huge, huge blood vessel. Okay? And the way that it works is that it maintains its name until it branches off again. So the common iliac branches off into the
External and internal.
right. The internal goes here into the pelvis. First of all, the name iliac, there's a reason for that. It's named the iliac because it's named after this bone right here. Now, you understand that this is the pelvis, but the pelvis is actually made of 6 bones. Three pairs of bones. The large elephant ear looking thing here at the top, that is the iliac. I'm sorry, the ilium. So things associated or nearby it are called iliac. So common iliac, then this is the internal iliac. Out here is the external iliac. And we continue with the external iliac all the way until it goes down the leg and then starts to branch off. Okay? Down the leg, this blood vessel is also named after the bone that it's next to, just like the radial and ulnar. External iliac comes down here and branches again right there. At the branch, it branches into the deep femoral, which goes a little further down into the tissues, and then the femoral. You guys seen the movie Black Hawk Down?
Yeah, heard of it.
Yeah, that's one guy that got his leg blown off, like right here. They were trying to reach up into this guy's muscle to grab the femoral artery to clamp it off, because there's a lot of blood that comes out. It's a huge vessel. It's probably, in some people, I would say it's almost as big around as a dime. Yeah, it's huge. So it's got to supply a lot of blood down here to the legs. So that's the femoral. Then next is renal. What does renal mean? Anybody? Alright, cool. We'll all learn together. Renal means kidney. So if somebody has renal failure, what does that mean?
Kidney.
Yeah, their kidneys quit on them. The renal artery supplies blood to the kidneys. Now, not only does it supply blood for the kidney to be able to function, the renal artery is also important because it's sending blood to the kidneys so that it can be filtered out, because that's the purpose of the kidneys, is to filter your blood so it can get rid of the impurities and toxins. Yes?
Question, can you only survive with one kidney, or do you have to have 2?
You can easily survive with one, okay? But it's good to have a spare. Alright. Some people are born with 3.
How does that happen?
Yeah, I don't know. It's a weird organ abnormality, but it's a good one to have, though. Also, when they transplant kidneys, they don't put them up here. They put them down here.
Why'd they do that?
What's that?
So that's where I always thought they were anyway.
Yeah, your bladder's down here. So like when you have to pee, sometimes if you really got to go, you'll feel it right there. But your kidneys are way up here. Now, they put it down here because when they replace a kidney, these are so deep in tissue in the back there, they're covered with like several layers of something called fascia, which are connective tissue. The deeper you go into those tissues, the greater the risk you cause of a deep infection, and so it's dangerous to go quite back that far. And you don't have to remove them. Just because they stop functioning doesn't mean that the cells in them are dead, so they leave those in there and put another one in.
Wait, was somebody okay with 3?
Yeah.
You're sick for life.
Yep.
I know.
And how do they get their kidneys out and cause an infection?
They don't.
Then how do they transfer them into someone else?
Oh, yes, good point. There is a risk. There is a risk for infection, but when somebody's donating, either they're already dead.
Oh.
But you've got a good point. The kidneys is one of the few things you can still be a live tissue donor for. You can donate a kidney, or you can donate part of your liver, and you can donate blood. I think are the only 3 that you can actually donate. But yeah, if you're giving your kidney, you're taking a risk. But you know, rather than giving that risk to both the donor and the recipient, they just do this for the one. That's a very good point. Okay, so renal artery going to the kidneys. Is that it on our arteries then? We're moving on to veins. Good news is, if you know your arteries, you pretty much know your veins. The only difference is what?
They run the other way. Exactly.
So I'm probably still going to screw this up and say this branches off to this. That's not really true. Like, what's this vessel right here, guys?
Vena cava?
Superior vena cava, that's right. Now, it's not correct for me to say that the superior vena cava branches off into this and this.
Because they both branch into that.
Right. These 2 vessels come together to form the superior vena cava, because all the blood is headed back this direction. Good question was asked of me yesterday. How does the blood go from one to the other? Okay. To get to the veins, notice that as we're coming back, we're starting with smaller and smaller vessels that I told you I'd mess it up, that come together into larger and larger vessels all the way back to the heart. These veins came from smaller vessels. What are the smaller vessels that lead into veins called? You should have that in your notes. Eventually, yes. Venules. Venules lead into veins, and venules come from capillaries. Where do capillaries come from? Tiny, tiny arteries called anyone? Ruler.
Arterials?
Yes, Jill. Arterioles. Excellent. Okay. So what happens is blood leaves the heart. It travels to arteries. First elastic arteries, then muscular arteries, then arterioles. And then it has to hit a capillary bed.
So it basically makes a U-turn.
Yeah, it does, but something important happens at the capillary. What would that be?
Does it decide whether it's oxygenated or deoxygenated?
Yeah. What happens at the capillary is pretty much the whole purpose of your cardiovascular system is nutrients and such are exchanged at the capillary. Nutrients go through there, oxygen is delivered through there, and carbon dioxide is picked up at the capillary. So, this is kind of a rough sketch of what a capillary might look like. If this is an arteriole feeding in, this is a venule going out. Surrounding this, you'd have tons and tons and tons of cells, okay? And this is a microscopic little blood vessel. And things would diffuse out and so on and so forth, and carbon dioxide would diffuse in, and that blood would travel through the venules, the veins, so on and so forth. So pretty much anything that's entering a vein had to have gone through a capillary. Does that make sense? Okay. This is going to be really, really easy, because if we know the arteries, we know the veins, just know they're going the other direction. Question.
How is a blood transfusion done?
A blood transfusion?
Yeah.
They take your bag of blood and that you donated to the said person, and they put it on one of those little deals, and forgive me, I don't know the terminology, the rack like they hold IV fluids with, and they put it into your blood vessels.
That's it?
Uh-huh.
Oh.
Yeah. I wouldn't try it at home, though, if that's what you're driving at. Okay. So superior and inferior vena cava, we know this from our last unit. Superior means what, guys?
Bigger.
Nope.
Above.
Means above. So this is the superior vena cava. This is the inferior vena cava. This inferior vena cava is in the same place as what major artery?
The ascending aorta.
Right. It's not going to be in the exact same location. In fact, if you were to look at a cadaver, and you will, in was it May or April? I don't know. Yeah, I think it's May 4th, I believe. That they're going to be right next to one another. So the inferior vena cava is going to run up the back of the abdomen here. Large vein, full of oxygenated or deoxygenated blood.
Deoxygenated.
What color would that be?
Dark red.
Good. All right.
Blue.
Blue. How dare you?
I think it makes sense.
Yeah. All right. So, okay, brachiocephalic in the same place, but here we are symmetrical. These two large vessels collect blood from both the head and the arm. That's why brachio, arm, cephalo, head. They collect blood, they're going right here, and they come together to form the superior vena cava. The next thing is the external and internal jugular veins. Major blood vessels. Okay? And they are named this for their location, and it's not as easy to see in this particular picture, but one is much larger than the other one. You can see that from here. Okay? Just has to do with where they're headed. No pun intended. Okay. Actually, that's a bad pun because they're not headed that way. That's where they're coming from. Told you I'd screw it up. Did it again. These blood vessels are collecting blood from around the skull. Now, the internal jugular is coming from a major hole in the bottom of the skull called the jugular foramen, which is collecting all this deoxygenated blood from the brain and bringing it back to the heart. Then a lot of your facial cells and things like that and around the outside are going to have their blood collected by the external jugular vein, this tube right here. One is much larger, but what distinguishes? What is it that makes one called external and one called internal jugular vein?
It's closer to the skin.
Right. Did we learn a word for that yet?
No.
Okay, this would be a good time to write this one down then. The word for close to the surface of the skin. What word could you use to describe someone who you would call shallow? This is a stretch for you to pull this one up. It started with a letter. I'll be careful with this. It starts with the letter S. I've got words. Have you heard this term before?
Yeah,
superficial means close to the surface. I'll put of the skin.
Got a knife stuck in your arm and stuck in there superficially.
Yes, that's not pleasant, but yes. The opposite of superficial. I'm a little embarrassed to write this down because it's not very profound. The word is deep. Ironically, I said it's not very profound, but things that are deep in the body, the Latin term for deep is profundus, where we get our word profound. So, what would I write down for this?
What?
Not close to the surface.
Yeah, say away from the surface. Okay, so superficial or deep. These are relative terms. You're referring to one in respect to the other one. It's like a family reunion. It's all relative. Yeah. So, yeah, they just keep getting worse, don't they? So, when you're referring to something as medial versus lateral, superior versus inferior, you're always referenced to some other point. Okay.
I thought we didn't learn about the vertebral thing.
Yeah, there's a vertebral one there too. There's lots and lots of them that we're not responsible for, but I'm just hammering out the big ones. The vertebral one we will discuss when we discuss the bones of the spine, though. Okay, so the next thing is renal. Renal is going to be where, guys?
Kidneys.
The kidneys. Like I said, once you learn one, you learn the other.
Wait, would they have to reroute the vein for the kidney whenever they do a transplant?
No, the cool thing is you can hook one up wherever you want. As long as you're hooking it up to a major blood vessel.
So I could stick a kidney here.
Technically, but it would probably get infected sitting on your shoulder. Okay? But yeah, as long as you're hooking it up to a major artery and a major vein, you're good. Yeah. Go ahead.
Did you say that the external jugular was closer to the surface?
Correct. In other words, it is superficial. Good. All right. Next is brachial. Brachial artery. I'm sorry, brachial vein is going to be
The arm.
in the arm. Oh, where'd you go? Right there. Okay. Then subclavian is going to be where?
Shoulder.
Underneath the...
Clavicle.
Correct. Good. Underneath the clavicle. And then radial.
The thumb side of your forearm.
Right. Note there are other veins here. It seems that we have a lot more major veins than we have major arteries. That's why we can take some away sometimes. We'll get to that in a minute. But you need a lot more roads back if traffic is moving slower, I guess. I don't know. That's not a great analogy, but you have less major arteries and more major veins coming back because the pressure in here is significantly less coming back. So we need more ways to route it back through. So radial is going on the thumb side. Ulnar is going on the pinky side, right here. Major veins. Okay. Besides that, we have great saphenous. This is the one we were talking about. I was referring to when I was saying we could take some out if we want to. This blood vessel starts all the way down here at the foot, the ankle, and goes up the inside of your thigh, all the way up to the yeah, right by the iliac. So, is there a view of just the leg here? Here we go. Yeah, just a gargantuan blood vessel. Okay? Now, the reason we can take this out, the reason we want to take this out, is when we do bypass surgery. When they do bypass surgery, it's because there are blood vessels in the heart that are blocked. And we need to supply blood to those in some way. And we need a blood vessel, one that will match. So, we clip out the great saphenous vein and attach it to the outside of the heart and bypass the blood vessel. That's what a bypass surgery is. It means that there are several large blood vessels on the heart called coronary arteries that supply the heart with blood. There's a stent. There we are. On the heart, we have several large arteries that are supplying blood, circumflux. Then we have right where are we at? Right coronary artery, so on and so forth. So there's several major blood vessels here. A triple bypass means that we're going to bypass 3 of these major arteries on the heart because they're blocked. Yeah.
What happens in a gastric bypass?
Gastric bypass, the word gastric means what, guys?
Stomach.
Stomach, which means they actually are going to bypass the stomach so people won't eat as much. We'll talk about that when we get to the digestive system. But a bypass, just like on a highway, you'll see sometimes the road signs will say bypass because they're completely changing a section of highway. Like Highway 40 in St. Louis, they've got a whole gigantic section of it ripped out. They're replacing it. So you have to bypass that, so it'll say bypass, go this way. It's the same principle. You're just moving around through some other mechanism.
But wouldn't that cut down the digestion process if they bypass the stomach?
You bet, and we will definitely talk about it when we get there. Okay, I'm going to leave that page available because we're going to go back to it. Great saphenous vein is huge. It's also pretty close to the surface. Sometimes you might be able to palpate it. You might be able to feel it. There was an episode of CSI where this guy who was I think he was like a electric or cable worker, where they had these like the spurs on his boots that he'd climb the poles with. And I forget why he was upset with this fellow. I think there was a woman involved in some way. He kicks the guy with his spur, like right on, and slices the guy's great saphenous vein. And the guy didn't realize he was dying because you can bleed out super fast through this vein. And he was standing there, and like 2 minutes later, he's dead. He had no clue. I don't know if the guy realized that just kicking him like that, if it was intentional or not. I think Hannibal Lecter killed somebody like that too in one of the. Yeah, never mind. These aren't pleasant things. All right. yeah. So this is how you operate, huh, Helle? All right. What's next?
The femoral.
Yeah, femoral. Femoral's in the same spot, right next to the femur. Yep, right next to the leg bone. And then after the femoral, I've got the coronary sinus and the great cardiac vein, which you guys might have had some trouble finding because they were actually on the heart itself. And they're located right next to each other. Guys, what's the purpose of these blood vessels again that are right here?
Supply blood to the heart.
The heart takes care of itself. Look at this. Here comes the aorta. Look at this. The first few gigantic branches coming off the aorta is the heart supply of blood. It's like, okay, well, good. We did all this pumping. Now let's get some for us. So there's blood right here, blood vessels coming right off of there. Now that blood is going to the cells, the muscle cells in the heart that are doing the pumping, and then that blood needs to be delivered then back to the heart. So the great cardiac vein is this one right here. Huge blood vessel that is collecting deoxygenated blood from the capillary bed surrounding the heart muscle. Then that great cardiac vein in this picture you see comes in, and all these other vessels attach to it and come together to this one ginormous bulge of blood vessel right here. Guess what that's called? That's right, the coronary sinus. This is the coronary sinus right here, when all the blood vessels are emptying into it. Typically a sinus is referring to a hollow chamber in the skull. If it's a big enough blood vessel, it can be referred to as a sinus as well. Guess what chamber that this blood vessel empties into? There's only one that would make sense.
Right atrium.
You got it. That's it, guys. Any questions about this material?